Well, a warm welcome to today's talk. It's Thursday, the 27th of January today. Now, in a minute, we're going to go to a special report from Africa from these two gentlemen here, from Wafafa and Dr. Machacha. But before we do that, I'm just going to give you a bit of a rundown of the main points. So this is good news. So it's the interview with Wafafa and Dr. Machacha. Regional COVID medical. So Dr. Machacha works at the Regional COVID Medical Centre, so has been seeing a lot of patients. They've managed hundreds of patients. He's personally taken charge of the care of 78 patients, so he's pretty well experienced. Now, the age of patients he's got coming in mostly to his clinic or his hospital are 45 to 65 years of age. He's had no patients under the age of 25 and certainly no children in. And this is not just his personal experience, this is the whole centre. So in the medical centre where they've seen hundreds of patients come in, they've had no children admitted at all. And that includes the previous Delta wave as well as the current Omicron wave. So that's pretty good news really for the African situation in children, which is one of the things we were really quite concerned about. Most of the patients admitted have got comorbidities, obesity being the most common, then diabetes mellitus, then hypertension, and then asthma. Critically ill patients have been older with comorbidities. So they saw quite a few critically ill patients with Delta, very few with Omicron. But the ones they have seen have been in the older age groups with comorbidities. Omicron patients are less ill compared to Delta, so the patients is getting now are less ill. The severity has really changed, he says. It's much less severe now. Delta was a dangerous variant, but now 90% of the patients only have mild disease. They have mild cough, influenza-type symptoms, anorexia, loss of the sense of smell. The hospital actually has some free beds, so there were some delegated beds for COVID, and some of those are free. In fact, about 70% are now free. So really, this is incredibly good news from Africa, because we were so concerned about the lack of facilities, and there is a lack of facilities, but even the meagre facilities they have are being underused, which is really, really incredibly good news. Hospitals free, but 70% free beds. They've hardly needed any oxygen this time in the Omicron wave, which is good. They now have enough oxygen, whereas oxygen supplies were really stretched with the Delta wave. Since Omicron, there's only been 3 patients. So since the end of December, there's only been 3 patients that needed oxygen. So only 3 oxygenated patients, and I suspect they had comorbidities as well. Normally, when patients are admitted, their oxygen saturations are above 90%, with the oxygen saturation probes put on your finger, and few have needed ITU support. The treatments that have been offered generally over both waves, oxygen if needed, dexamethasone, erythromycin, and vitamin D, and sometimes vitamin D and zinc and vitamin C, although there's debate about vitamin C, as we'll see. They also use local remedies. Now, one of the things I like about Dr. Machacha is his humility. He's prepared to accept local remedies. He knows that very often there is no strong evidence base. Sometimes he believes they're helpful, other times he believes they're not. Personally, doing some work with herbal medicine in Kenya, I have seen some results from herbal medicines that are used locally that look impressive. I've never had the time to go back and do the full clinical trials. I wish someone would, because I think we're missing out on a trick here with African herbal medicine. So he agrees sometimes it's useful, other times it's not. Sunbathing, he says, is well and good. Average length of stay in hospital is 4 to 7 days. Very few patients now coming in with a low level of consciousness. Treatment for Omicron is the same as for Delta. He hasn't changed his treatment strategies. It's just that it's less severe. He's not giving steroids early. He waits till the patient becomes septic with a cytokine storm before giving steroids, which makes perfect sense to me. Cases in Uganda are down with absolutely minimal testing. They're hardly doing just a few hundred tests a day, really. A few thousand tests a day and a few hundred positives, just because of the resources aren't there. Most symptomatic patients are not tested, he believes. Now, of course, we can't prove this, but in his clinical judgment, a lot of patients have been symptomatic lately, but most symptomatic patients are simply not tested. So a lot of this is clinical diagnosis. And he estimates, and again, it is an estimate, about 50% of infected people are going to be asymptomatic. Again, he can't prove that because he hasn't got the testing facility to do it. He says this is interesting. The Omicron variant is the vaccine we failed to make. He believes Omicron infection will fight any other kind of COVID-19 that comes along. Herd immunity, he believes, is likely. There's also cross-immunity, especially from viruses with similar genomes. Natural immunity is often the norm in Uganda, although they do have vaccination programs for essential things, of course. And with great humility, he says, I don't rule out the hand of God. Sick Delta patients would have been a catastrophe. So Omicron has saved him from looking after many dying Delta patients. And he has a great sense of humility about that, which I admire. He does say something is happening we cannot explain. Were that all doctors had that level of humility, unlike some others that could be mentioned, or some other politicians that could be mentioned. But without me getting started, without further ado, let's go straight on to the interview. Do try and stick through it. It's absolutely excellent. So here we go, and gentlemen, thank you very much.
Hello guys, welcome to today's COVID-19 update. I'm Wefafa Andrew, and I'm here with the Dr. Ivan Machacha Mungao. Yes, and he's one of the doctors at the treatment center here in Uganda. So previously I worked with COVID-19 in a quarantine center, but then they closed the quarantine centers, and I also got so busy with the community work, so I no longer interact with the COVID-19 patients. But today I got a chance of interacting with one of the doctors who is managing patients right now at the hospital. Since I'm away, there are some questions that I cannot give accurate information apart from giving general information. So we wanted to be a bit specific and get answers from the person who is dealing with the patients right now. So I'm going to be asking him about 10 questions that will help us understand the COVID-19 situation in Uganda and in Mbale, where he is basing. So doctor, I'm going to ask you some few questions for our viewers who are watching from different parts of the world, and would like you to give us some responses that will give us an understanding of what is happening here. So doctor, question number one is that since you started managing COVID-19 patients here, how many patients have you managed personally?
Well, I think personally I started working with COVID patients this year when we got the second wave in Uganda. That was around late May to June. And I think I've so far seen around, personally, me as a person, I've seen around 78 patients.
78 patients.
Yes.
Okay. Oh, that's great. So in the patients that you've been seeing, when you look at the patients that you've been seeing, or if you recall the patients that you've been seeing, which age group are you seeing most?
The most age group that I've come across during the process of treating COVID-19 patients has been around 45 to 65 years. And I want to assure you, of all the patients I've seen, I've not come across a person below 25 years.
Yeah,
I've not seen a child.
Okay, so you've not seen children getting being admitted with the COVID-19 and going into the isolation rooms on those treatment centers. Okay, thank you very much, doctor. The third question is, are people being admitted most with comorbidities, or they're just normal people?
Well, definitely it has been the patient with comorbidities that we have admitted most, and the highest on the list when we got the Delta wave was obesity. Obesity, followed by diabetes mellitus and hypertensive patients.
Okay.
Those are the three commonest conditions that most of the patients we were taking to ICU or high dependency unit or HD have been having those three conditions. However, there are others like asthma, asthmatics have come across them.
Yes.
So in other words, we have had patients mostly critically ill have been those with comorbidities.
Okay. Oh, thank you very much. So in even the old people that have been admitted, most of them have been with the comorbidities.
Yes.
Though there is a proportion maybe of those ones also who don't have them, but they may be low.
Low, yes.
Okay.
Yeah.
Oh, thank you very much. So another question. Since you started managing these cases, I understand in the second wave, that was when there was Delta still, right?
Yes,
and now we have the Omicron variant.
Yes.
have you noticed a change in severity of the illness of the patients who were like from Delta to Omicron?
Yes, definitely. The severity has really changed. Right now we're having 90% of our patients having no symptoms.
No symptoms.
Or have mild symptoms.
Yes.
In other words, the Delta variant was a mess. It was a really dangerous variant. But right now what we are having is basically treating asymptomatic patients or patients who come with mild cough,
yes,
mild flu, or mildly maybe some kind of loss of appetite or loss of smell.
Okay.
In other words, we have not really admitted many in our high dependency units or intensive care units.
So that means as I talk, your treatment center or the intensive care units for COVID-19 patients, they are not overwhelmed.
No, we are not overwhelmed actually.
That means, should I say that if we were to go right now, you can be able to find some free beds, though there are patients on sleep?
Yes, majority of the beds are actually free.
Okay.
Yes, we have a few beds occupied with a few patients, but I think 70% of our beds are free.
Okay.
Since most of our patients we're treating them as outpatient basis because of the severity, which is low.
Okay.
Yeah.
Well, that's a good sign, and that is good news for all of us. So you say that most people, very few people have been admitted right now. So that means even the need for oxygen, when you try to compare now and in the previous wave, and in the previous time when we had the other variant, Delta variant, it means the need for beds and oxygen also has reduced.
Yes, actually.
Is the oxygen supply enough currently?
Actually, we have enough oxygen supply, but in relation to the number of patients we have who need oxygen support or therapy, was actually, since we first had the first case of Omicron virus in this country around late December,
yes,
I think I've only seen 3 patients so far, around 3 to 4 patients who have come in severe conditions that need oxygen therapy. Otherwise, others come with their saturation of above 90, so we really don't give them oxygen as such. So the demand for oxygen is low, and we have it enough supply.
Okay.
Yeah.
So, which treatment are you giving these patients here?
Actually, basically, what we have been using is the first mechanism, the first modality with our COVID-19 patients, that since they come with low saturation of oxygen and they are with difficulty in breathing, we have always given oxygen as a first therapy.
Oxygen therapy.
Yes. Then we also tend to give corticosteroid in severe cases like dexamethasone, very good. And we also tend to give them antibiotics, basically macrolides like azithromycin. They have shown us good results. Then other supplements that research has shown that they help in COVID-19 treatment, like vitamin D, like zinc. We tend to add them those supplements. Like vitamin D, we tend to give them seafoods, which have a lot of them in quantity. I think even vitamin C at times give, though the current literature that we are being forwarded, that is being forwarded to us, is discouraging the use. But basically that's what we are doing. But on top of that, there are also other locally made drugs that some patients want to opt for. They even request that let me go and use the locally made drugs or herbs,
and which has helped some
and some doesn't help. So we don't have the scientific backup. And then lastly, of course, intensive care. Intensive care. Patients with saturations that are in very low. What do? Support them, intubate, support them with oxygen, feed them via any cheat tubes until they respond.
So I have heard that on top of that, you recommend also some sunbathing. Is it so, like for your patients? Actually,
I think the theory of sunbathing is in relation to vitamin D.
Yes.
It's in relation to vitamin D. And of course, a critically ill patient who is in ICU, you won't tell them they go and do sunbathing.
Yes.
But the patients who are not in severe cases and have the ability to move out and do some sunbathing, well and good.
So that means you recommend for some can move who are able to
move. Instead of dietary intake, you can also support and get vitamin D activation from this.
So what is the average stay for the patients that you've been receiving so far?
Well, averagely it should be around 4
Yes.
to 7 days.
4 to 7 days.
For those who are not so much critically ill. But there are patients who come in almost in coma, whereby the girl's coma scale is below 8.
Yes.
So those ones tend even to finish even a month in our intensive care units.
Yes.
So it varies based on severity and how someone's immunity responds to the disease. So it is very bad. Averagely 4 to 7 days. 4 to 7 days.
Oh, thank you very much, doctor. So, like you say that there's been a change in severity. So has there also been a change in treatment from Delta variant to this Omicron variant, to the treatment that you've been giving, or you've maintained the same treatment that you told us?
Actually, there's been no much change in treatment. Just nowadays, now we treat based on severity.
Yes.
A patient who is not severe ill, why would I, with saturation above 90 or 95, why would I give you oxygen therapy? I wouldn't give you that. Yes. Now, a patient who is also not severe ill, we wouldn't always recommend hurrying with corticosteroids. We always wait for that storm, the immunity storm, before we use corticosteroids. So we also don't use it for a patient who is not critically ill. But the treatment manual still remains what? The same. But we judge. It's a clinical judgment based on the severity.
Oh, thank you very much, doctor. Now, lastly, my question is, do you think or do you believe there is now herd immunity in Uganda? Because there is an article that I read earlier in the day, and we saw that in December, early December and late December, even early January, let me say, the number of cases that were reported daily countrywide were about 500 cases per day. But now I read, and it was showing that we are reporting as a country on average around 138 cases per day. So does this data suggest that there is some sort of herd immunity, or what could be happening? Why do you think numbers are lowering, and yet at first they were high?
Yeah, Miss Andrew, first of all, one factor that you'll have at the back of your mind is that we're in a low-income country.
Yes,
whereby
country.
The rate at which we test our patients is so low.
Yes.
We don't overtest.
You don't overtest, true.
So we tend to test mainly those who are entering the country.
Yes.
At maybe the border post like in Malaba and the airport at Entebbe, and then those who come to hospital with the signs and symptoms.
Yes.
So in other words, I think we have so many patients out there with COVID-19 and asymptomatic.
Yes.
But we are not testing.
We are not testing. Yes.
We don't have the capability because we are so limited.
Yes.
And by the fact that we are having almost 50% of patients with COVID-19 asymptomatic,
yes,
not coming to hospital to seek treatment, I think that gives me the picture. I think we already have had what? Immunity.
Yes.
People are getting the disease, but the immunities are what? Sustaining them and fighting off the what?
Yes.
The infection. So to me, I think it's a clear sign, it's a good sign that the battle against COVID-19 is on the right track.
Yeah,
actually, I was reading also an article, I think in the one of the journals, and they were saying that the Omicron variant is the vaccine that we failed to make.
Yes.
In other words, everyone is getting it.
Is getting it, yes.
Not having any serious illnesses, but it's boosting the antibodies
yes,
to fight any other kind of what? COVID-19. So in other words, I think we're heading there. We're getting the herd immunity.
That means even given the low testing that they have done, the data is showing that numbers are dropping.
Yes.
So that means there's a possibility that there is herd immunity. Yes. And also there is another theory that talks about cross immunity, given the fact that in Africa we are exposed to different viruses without treatment as we grow. Yeah. So probably immunity from these other viruses is crossing somehow, helping into fighting this virus as well.
Especially viruses in the same, with this kind of similar genomes and factor like that. Because you see, one fact we also know that we live in a dirty environment in Africa.
Yes.
We don't live in top-notch, clean environment. So as a child grows, you're exposed to a number of viruses. Actually, for us here in Africa, when a child coughs or has flu, it's normal.
It's normal.
In the villages, people just, it will pass.
Yes.
It will pass. So it's stage by stage. So I think it also contributing.
Somehow.
But I think I'm also a Christian. I don't rule out the fact that there's also the hand
There's
of
intervention from
by
God.
Because just
Wow.
imagine,
Yes.
just imagine if we had the 1,000 patients coming to our ICUs every day in this country, Uganda.
Yes.
Do you have the intensive care unit beds?
No, they are not enough.
Even the high dependency units are not enough.
Yes.
So we'll be in. It will be a catastrophe. So I
Yes.
think even with the spiritual realm also intervening.
There's something that is happening that we can't explain.
Yeah.
Okay, thank you very much, Doctor, for your time. Hope to have you next time on this very channel. Thank you very much.
Thank you too. Thanks
Yeah.
for reaching out.
Yeah.
Please.
May God bless you.
God bless you too.
So our viewers, see you in the next video.
Well, thank you, gentlemen. Dr. Machacha and Wafafa, of course. Great to see doctors, while everything he said there was clinically competent. Of course, we're not recommending his treatments, he's just reporting what he does. But the humility that we don't understand everything is often lacking in many areas. And one of the quotes of that video there was, "We don't live in a top-notch environment." I think that says quite a lot, really. Thank you for watching this video, and I'll put all these questions that I've had, all these points that I've had here, I'll put those down, and I'll put links to Wafafa's channel as well. Do click on it for lots more interesting health-related content from the Africa situation. Thank you for watching.